So as I said, 1998, she saw the onset of a larynx carcinoma who had with metastasis in the lymph nodes, and she received then a combined surgical chemotherapy and radiation treatment in 1998 and the subsequent months and years. Later on, she also developed another cancer entity in 2008, a cervix uteri carcinoma that could be resolved by surgery only. Notably, and I've never ever encountered a patient who has said that to me, I couldn't believe it, but it's actually true. I saw the files. She had undergone, since 1998, 70 surgical procedures for her two carcinomas. Some of them, being very minor, sort of, plastic surgery also, to resolve this. And she also has a tracheostoma and a esophageal tracheal fistula. So a lot of surgery that had been done. I mean, just imagine what that does on your prakriti, on your vikriti in particular, if you undergo 70 surgeries. I was shocked when I read that. And I was also shocked how she presented. If you would see her, you wouldn't think she is sick at all. Very fascinating lady. She sits there. She is nicely dressed. She's nicely made up. She's smiling. She has, has a very good contact. And when you're reading this, you would expect to meet somebody who is down the drain. And I don't know how she does that, but and she told me, "Damn, you're again some one of those people who tell me this, and it really doesn't help me because I feel." She told in German. She told me, "I feel like shit, and everyone is telling me how good I look, and I feel completely tired, exhausted, worn out, and it doesn't help me if you tell that." It's just as a side note. So she was complaining about chronic fatigue and also morbus Meniere. I don't know if you know that condition. It creates a very intense vertigo in form of vertigo attacks and a pain of the vertebral column, so lower back pain in particular. And also as a result of all the surgery and the tracheostoma, she had developed a COPD in the Gold 4 stage, so an advanced COPD. This is for her current medication, which is, again, I was sort of surprised to see somebody with a moderate medication, actually, from the conventional perspective. If you would you would assume that a patient like this would take much more medicine. So she was on omeprazole due to reflux. I find that almost that in almost all conditions, or to put it in a more moderate way, at least more than 50% of the conditions, omeprazole, PPIs are prescribed without any indication. People are just using it. Without knowing why they have it, in many cases, or without having any indication for taking it, like her.
Without knowing what they do.
Yeah, definitely. And she was taking novamine sulfone, Novalgine, which is, I think, forbidden in the Anglophone countries, at least in the UK and the US. It's a very beliebt, beliebt. It's one of the most favorite, one of the preferred painkillers, but it can cause severe cases of neutropenia. That's why it is banned in some countries, but in Germany it's used widely. I actually like it from a conventional perspective. I like to, as a conventional, because it creates less side effects than most of the NSARs. Arcoxia, classic COX inhibitor, which was banned for other conditions, but she was still taking it. I don't actually know why she was not taking ibuprofen or any other. She was taking Arcoxia. And tramadol, of course, then a mild opiate on demand. And then she was also taking anthroposophic medicine. from the Ayurvedic perspective, how did she appear? So she had at least from my assessment, I think in a condition like this, where you see somebody who has undergone 70 surgical interventions, it's hard many times to actually assess Prakriti, because you're confronted with such an intense Vikriti that I think, at least for me, as I would still consider myself a beginner of Ayurveda, it's hard to really delineate what is Prakriti and what is Vikriti. So anyway, I decided upon a Pitta Vata Prakriti, and obviously a very intense Vata Pitta Vikriti. I would actually like to debate this with you and also maybe with some of the pundits above, because she had a kapha decrease, so I don't know whether you could also label this as Sanipata Prakopa, because all doshas are out of order. But Sanipata means an elevation of all three doshas, but here you also clearly can detect an involvement of kapha in terms of being diminished. So Agni was Manda beyond any doubt. I decided upon an involvement of all dhatus in the Samprapti, and also an involvement of all relevant srotas, a clear involvement of Ama, a strong, like in the previous patient, a strong disease power and a weak power or a general level of resistance on the side of the patient. And the nadi was very vata driven. The tongue was of medium size. It had a very obvious tremor. It was cracky, it was dark blue, and it had a white sort of slimy coating. And also here we see a clear-cut case of a beta stage disease. So you have to know that she underwent so many therapies. She just got divorced, or at the time of the time I met her first, she had just separated from her husband then, and she had paid so much for complementary therapies that she was completely bankrupt. So she did not have any money. So what to do then? So what we usually do, so we try to do it according to the Robin Hood principle, that if they show us that they're not able to pay for it, then we reduce the costs either to the costs that we are having by paying our personnel and room rents, so we do not make any benefit out of it, or in some cases we also give it to them for free, or we try to, there's a couple of foundations who support patients' treatments, if it's not supported otherwise, to apply for a for a grant. So I decided that at least she should go for an individual dietary advice, in particular to with the ultimate, or with the biggest goal to reduce vata in her system. And I thought it would also be a good idea to make use of Guduchi, of Emblica, of Centella asiatica, and Brahmi. This was actually a mix of crude herbal drugs from Euroved, so the Beiprodukte, and also extracts. So Guduchi is hard to get by in Europe, other than in extracts or churnas. And I've made this is also very personal. I do not like to prescribe churnas just because the compliance of the patients is so bad with churnas. And I like compliant patients because it helps them more if they're compliant. And in particular, if you take churnas like Guduchi or Nimba or Musta, which are very bitter, people have this tendency to not stick to the regimens that we prescribe. So this is just my personal issue. I don't know if you're experiencing the same, but that's the reason I do not prescribe churnas very much. So other than that, I also like herbal tablets, and there's also not a very large selection of available tablets. So this was an eclectic mix of Eurovit products and pharmacy alcoholic extracts. So Tinospora, Guduci, and Manducaparni, Centella asiatica were extracts, and Emblica and Brahmi were herbal tablets. So manual therapies, we were discussing about it. I think it would be wonderful in her case to also get massage therapies, very light, not using too much oil, and using a heavy vata reducing oil that works in particular on the nervous system, so Mahanarayam Thailam. But looking at the ama involvement, it's always debatable, whether or whether not. But looking at her problem and the diffuse bodily pain, in particular due to all the surgery, her exhaustion, her sleeplessness, I've decided to go for it anyway and to just do a sort of upashaya, like a diagnostic test, and just find out whether it increases her pain or not. And but she couldn't afford it at this time, so it remains a virtual recommendation. Yoga, in particular, also in her case, pranayama. I'm a very big promoter of pranayama, so that was also on the list. I advised her to try to at least get one individual training session for yoga and pranayama. And we were also debating whether it would be a good idea to get admitted to our CAM ward, so to get admitted to the hospital. So as I said, the patient does not have any money, so sort of trying to make ends meet with her. So we applied for a grant and told her to at least use whatever money she has to get the herbs and to come back to me in 3 months. So she came back, when was that? I have to check that. In January, and then she came back in May. She said she's much more energetic and her mood has improved. There's less tongue coating, and unfortunately the application for the grant was denied because also unfortunately that foundation was had used all the money for that year already in May, so they couldn't cover it. So I told her to continue with the herbs and to get admitted to our hospital in the fall of 2013, which is still in the pipeline. This is a very open case, but I would just sharing this with you to show you that and to encourage you also to also treat patients who are who have a severe disease burden, and to not, get demotivated by, the severity or the complexity of diseases. We can do a lot, in particular for those patients, and also with small measures. I mean, here you see, there's a grand idea of a multimodal therapeutic approach, which doesn't work. But with small things, just, a single session of, talking about diet and yoga and the administration of a couple of herbs can do a lot. It doesn't resolve all her problems, but it changes her quality of life and her energy level. So you can achieve big changes with small measures also. And also encouragement to if you find out that you're not able to follow your grand strategy, choose maybe choose a small therapeutic approach. And I always like that saying, when in Rome, do as the Romans do, or when in Berlin, do as the Berliners do, or when in London, do as the Londoners do. Let's try to sort of make maximum use of the setting, the patients, and whatever else, and be flexible in your approaches. So I'd say, as a sort of quintessence, Ayurveda always works holistic, multimodal, and individual. It's not a mean value-based system of medicine. Let's keep that in mind one more time. And, most of all, at least this is my take-home message, and I said it earlier already, the standing of self-effectiveness and self-healing really enables the patients to actively take part in their own health-related processes. And I think that's wonderful to, eventually make, little doctors or therapists out of your patients, and, make partners out of your patients. And it works so wonderfully, and it creates such a good atmosphere, and it's so rewarding also for us. So that's all I have to say. And should you have any questions, do not hesitate to contact me anytime. This is the easiest way to do so. So thanks for your attention. And I don't know if there's any questions, maybe before you clap. Is there any questions, any urgent questions? Or well, then enjoy lunch. Thanks.